those of this station, its staff, management, or sponsors.
Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info Show. I'm glad that you could join us today. Well, we're still in the midst of this pandemic, coronavirus, COVID-19, and I know everyone's getting a little tired of everything about it. Are you confused about what you've been hearing on the news? Are you worried about having to go to your doctor's office and maybe waiting in a waiting room with other sick people? Are you not sure what you should do, what you shouldn't do? Do you have questions about wearing a mask and when to wear it and what kind of mask to wear? What about those long lines, people waiting in cars to get COVID-19 testing? Should you be there? So we're going to talk about all that and more today. And my guest is going to be talking about his experience and everything that he knows about what's been going on because he's out there in the field doing testing. His name is Seth Levy, Dr. Seth Levy, PhD, and Seth is a partner with Doctor's House Calls, and he's joining us via the video there. Hi, Seth. I see you on the screen. Welcome to the show.
Hey, good afternoon. And
Good to see
as you
you.
said, Marcia, my name is Dr. Seth Levy. However, I am not a physician and I don't play one on TV.
Well, I like that you work with doctors. You're not one. You do have your PhD in public health, and that's good. You've got the right credentials. You're out there in the field. You're working with the physicians, and now this coronavirus is putting everything in helter-skelter. So we want to focus on that, but I do want to let everybody know you were on the show maybe 3 years ago, and we talked about the house calls, that doctors still make house calls. And that was the topic of our conversation.
Yeah.
And
so my company is called Dr. House Calls. We are a mobile physician group. We have doctors, nurse practitioners, and PAs that see our patients. We see them in assisted living, independent living, as well as private homes. We cover all Broward, all Palm Beach, and the entire Treasure Coast. And we are a direct Medicare provider. We take most other insurances as well. And we're actually, as far as I know, we're the only mobile physician group in the state of Florida that's actually licensed by the state, by ACA, as a mobile physician group, as a healthcare clinic.
And how long has the company been in practice?
I'm very old. I've been doing this a long time. I just celebrated my 32nd birthday. And our first company is called MDDU, as you well know, had over 5,000 patients, 22 patients over the age of 100. So I was very proud of that. We started this company about 3 years ago, myself and my partner, Adam, and we've been doing it ever since.
Right, I know. Way back when you've been in this business for many years. I've known you for about.
We've known each other a long time. Obviously, you look great. You started when you were 3, so you know.
Well, thank you. So you do the house calls. So my burning question is, now that we're in this pandemic and COVID, the COVID-19 and the coronavirus, and it's got everybody topsy-turvy, right? So how has that affected the business, your business?
Well, we're extremely busy to say the least. So we still do in-home visits. We also do telehealth visits, and we also do the COVID testing for patients. We do them for staff, for employers, employees, home health companies, hospices. Wherever we're asked to go to test people, we go to them. So basically, I'm telling people, listen, unless you have a heart attack, a stroke, or your leg got bit off by a shark, don't go to the doctor's office or the urgent care or the ER unless you want to get sick. You'll get sick. So we bring everything to people in their home, wherever they live.
So are you finding that nowadays more people are contacting you for the COVID-19 related issues, like they're not feeling well, or are they
Yes.
contacting you for other issues because they don't want to go to the hospital or go to their doctor's office?
Well,
You
a
see
little, a little bit of both, and there's a lot of confusion out there. I will tell you, when it first started, a lot of people were thinking about getting the antibody test. And I'll be very honest with you up front. The antibody test is basically a waste of time and money. What does the antibody test tell you? You're either going to be negative or you're going to be positive. If you're negative, that basically means that you've been safe and you have not come into contact with anyone with COVID-19. If you're positive, that means you came into contact with someone, but what does that give you as far as immunity is concerned? They used to say maybe up to a year, now they're saying not even a month, because not only does it depend on the amount of contact you had with someone, but also the amount of time that you were with that person that was infected. So you might have a little bit of antibody, which is really not going to give you hardly anything. You might have a lot of antibody, which may or may not give you some immunity, but it's kind of be like very similar to any virus or flu. It's probably going to be something that's going to be an annual thing for a while, at least until we get a vaccine.
And again, this is very confusing to people because when this first started a few months ago, I had a friend who went and got tested for antibodies because he thought maybe he had something. He was not feeling good. He thought he had some of the
Yep.
symptoms, and it did come back positive, right? So the weird thing is that he has his wife, and they're together all the time. So her doctor said, well, maybe you should go get tested. And she came back negative. So this kind of a scenario is very confusing for people because we hear how contagious this virus is. And you have two people living together. How could one test positive for antibodies, meaning he was exposed, but his wife
Right.
was tested negative? Is there
Because with
explanation?
right. Because with the antibodies at the beginning anyway, and like again, I would not tell anybody to do it today. In the beginning, especially, there was a lot of false positives as well as false negatives. And again, even if you're positive, what does that change? It changes nothing. You still have to wear your mask. You still have to social distance. And you use your hands. Nothing changes. And even today, when you get a test, the COVID test that we're doing, you still have to follow those instructions no matter what. One of the biggest problem today is not necessarily getting the test. So a lot of places you can get the test. The problem is the lag time from when you get the test to when you get the results. And it could be 10 to 15 days right now. So you get the test and you're waiting, and maybe you got infected while that waiting period. So you really have to keep on top of it. You have to, no matter what anybody says, you have to keep your mask on. You have to wash your hands and you have to social distance. What they're finding out now is the major vector for this disease is the air. And the problem is when we're inside, whether you're inside a building, whether you're in an airplane, no matter where you are, you're basically breathing recirculated air. So if you're in an office building and somebody else on the fifth floor that you have no idea who is, maybe is either asymptomatic with no symptoms or symptomatic, and they cough, and it gets into the air conditioning system, and it can affect you. Now, the newest research is actually saying that some of these, the virus can actually stick around in the air system for up to 16 hours.
Wow.
But again, you don't know who can be a spreader, especially because of the asymptomatic people. And some of the asymptomatic people tend to be on the younger side because they have usually a better immune system. But the problem is they're they have a much higher propensity of spreading it. So when they go home to mom or dad, or when they visit their grandparents, that's the problem. And you have to remember, wearing a mask, my mask protects you. Your mask protects me. That's the biggest thing you have to understand. And it's just a matter of respect that I'm going to wear my mask when I'm around you, like so. And if you were in the room with me, I'm protecting you. Little plug.
Wow. This
But
is so
obviously right now there's
interesting.
nobody in the room with me, so.
There's nobody there. Okay, so you're safe. I'm safe. I'm in my home. Uh,
Good.
this is so good. This is good information. I don't think there can be too much discussion about this to sort of answer people's questions. So we're going to take a quick break, and we come back. It's going to be more answered questions by Dr. Seth Levy. We'll be right back.
Thank you.
The opinions expressed on the following
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'm back, and my guest today is Seth Levy. He has his PhD in public health, and he's also a partner at Dr. House Calls. And we're talking about COVID-19 testing. So, Seth, right before commercial, you put on your nice Dr. House Calls mask. I like that. It was a cloth mask. Let's talk a little bit about masking, because just recently on the news, local news, they did an experiment and they used different types of masks, and they had, the medical kind, the N95, the cloth, and then something that you just kind of pull up like a handkerchief type of thing.
Yeah, like a bandana.
So, yeah, like a bandana. So obviously, when the test results came back, the N95 were the best, and they didn't spread any bacteria into the petri dish. But now, not everybody can get one, afford one, have access to one. So there's other types of mask out there. What kind is the best? And, I would say any kind is better than none at all, right?
That's exactly what I was going to say. So, depending on where I am and depending what I'm doing, like today, I went with my staff, and we were testing a large amount of people at a independent, low-income senior housing independent facility down in Sunrise. So I wore both a cloth mask here, I wore this over it, and then I also had a face shield. So remember, the virus can, the number one thing is breath, breathing in, breathing out. So you can breathe in the vector, but also depending on where you are, you should also, if you're indoors and there are other people around, there is a possibility of the virus coming through your eyes as well. So that's why when
Wow.
you see uh, nurses and doctors, not only are they wearing a mask over their nose and mouth, but they're also wearing a face shield over their eyes. And that's why.
Should people start wearing goggles or glasses? Would sunglasses help if they had
Like
nothing else?
everything helps. And that's exactly what I do. I wear my sunglasses, both indoors and outdoors, most of the time. Um, but again, the more you do, the better it is. But the more you do, the more uncomfortable it is. So, but doing something is definitely better than doing nothing. Um, what's the best mask is the surgical mask that surgeons wear. There's a reason why when you have surgery, the doctors and nurses and everybody in that operating room is wearing a mask. Way before COVID, they always wore a mask. So if you think about that, these people that are saying the masks are ridiculous or this or that, think about if you were in an operating room and you were going to have heart surgery, whatever, and the doctor walked in and nobody had a mask on, you'd be like, you know, or the doctor came out of the restroom and you were in there and you walked out together and he didn't wash his hands. I don't think you'd let that guy operate on you or girl. So a lot of
Yeah,
it's
good
just common
point. The
sense.
gloves. Yeah, I mean the gloves, the mask, everything, the shield.
There's a reason. Again, they were wearing gloves and masks way before COVID-19 ever came along.
So I want to go back to something else that you said earlier
Sure.
about being in an office building. And let's say you work in an office building and you trust the people that you work with, because I know a lot of people that are with the same people day in and day out, and they kind of know where they've been and where they go. They feel comfortable being with them in an office without wearing a mask, especially if they're not in the public eye or they're not dealing with the public. And it's just them in the office, maybe a small office group. However, you mentioned that perhaps it's a big office building and the air recirculates and it can come through the venting system from another office next door, upstairs, down the hall,
Yep.
and you don't know those people, so it could actually come into your office at some point mixed in with
Right.
everything else. That's kind of scary. So
Extremely.
if that could
But even
happen,
if you think about a small office, let's say there's only 5 people in your office, and these 5 people, men or women, doesn't matter, they're married, they have kids, they have family, whatever it is. Uh, you know, somebody's at your house, or you have a teenage kid that went wherever. They're out with their friends. They come home. You go to their office the next day. You're infected, though you don't know it. Remember, the to me the scariest part of the COVID-19 is that people can be infected and asymptomatic for maybe 2 weeks. So all this time, when these people are infected, and they're not doing it on purpose, there's no maliciousness with it, but now they're going back into their office, they're infected, they're asymptomatic, so they think everything's fine, and now they just infected other people. And then those other people go home to their families. And this is the insidiousness of this COVID-19 and why it can spread so rapidly. So you have somebody that comes into your office. Let's think about the different types of people in your office. You have the manager there. You have maybe a secretary. You have different types of people. You also have, let's say, a cleaning person that comes in at night, right? And all these people go home to their families. Any of these people that are now asymptomatic can now spread it to their family, come back in, and spread it to the rest of the people in that office, whether it's small or big. It really doesn't matter.
Well, you kind of paint the picture a little bit more vividly with the details like that. So it
Like a
sounds
tree.
like, yeah, with the branching and all that. And, if you were in an office then, even if it was a small office and you knew the people, it would make sense from what you're telling us that you should always wear a mask all the time, even if you're not intervening with customers or the public. You should wear your mask
Doesn't matter.
all the time.
Does not matter. Sadly, it does not matter because, again, there are people that are asymptomatic that may or may not come into your office. And also, you got to remember there's a time factor. So let's say I came into your house and I was there just dropping off a package. Hey, Marcia, here's your package, and boom, run out. And maybe I was asymptomatic or you were, probably not a big deal. I didn't shake your hand, I didn't hug you, no big deal. But however, if I came over and I was lucky enough to have dinner at your house and I was asymptomatic or you were asymptomatic, doesn't matter. And we're sitting there for a nice dinner, which I've heard you're an excellent cook, so little hint there, anytime you want to invite me, I'll be happy to come. So, the more time that you're exposed to something, the more likely it is that you're going to become infected.
Yeah, I don't think people realize the severity of this. And then, of course, you hear
No.
on the national news this week that they were actually having the young kids, right? The teenagers, the early 20-somethings, right? They're having
Generation
COVID-19
Z.
parties. They were trying to get it. They were actually commingling and trying to get it, and somebody did get it, and they died. So I mean, it was a wake
Yes.
up call, for everybody else. But how crazy is this? I mean, we are living in crazy times.
Very scary.
Yeah, so you sometimes wear the double mask even when. Let me ask you this: do you go out to restaurants?
The answer is yes and no. I'll go out to a restaurant, but I will not eat inside. I only eat outside. I'm a very big advocate. I do a lot of biking. I do a lot of kayaking. When I'm doing those individual activities by myself, I feel very safe. Now, if you're in a place like New York and you're jogging down the New York streets, I would wear a mask. But as long as you're not around crowds of people and you're outside, it's pretty safe.
And if you're not feeling so safe, you could double up on the mask, like you had mentioned before. You could cover up with
I
two.
carry this mask with me 24/7. This never leaves me. This mask and my wife never leave me.
That's a good thing. That's a very good thing. I was looking at all kinds of different masks, and you see people wearing them all the time, and it's actually become a cottage industry. And
Oh, yeah.
anywhere you go, I mean, not just online, but I go into a store. Sometimes we have to go into some stores and not just the
Yes.
grocery stores. And I see them. I mean, they're for sale everywhere. So there's no shortage of masks, and
No.
so we need
My
people
wife
to.
actually has a mask, a Wonder Woman mask.
Oh, I want one of those.
I want one of those. It fits
Oh,
her
this
well,
is
believe
great.
me.
We're going to take a break to hear from our national sponsor. When we come back, we're going to talk more to Seth Levy, PhD, and about COVID testing and get more into the nitty gritty of the tests and which tests that you heard of, which
Yep.
ones you haven't heard of, and how that can affect the outcome. So stay tuned. We'll be
Thank you.
right back.
Looking forward.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia, Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities. Arden Courts is a leader when it comes to memory care because memory care is all they do. They have about 55 memory care assisted living communities across the United States, 10 right here in Florida. And Arden Courts is a good resource for not just the person with memory loss, but also for their caregiver. And they're giving away a book. This is called the 36-hour day. If you are a caregiver, you know how long your days are. You can just imagine they're not the normal 24, or it feels like they're not the normal 24 with everything that you have to do and all the stress that you're under. So this book is a great resource, and it's absolutely free for you for the asking. The 36-hour day was written by Dr. Peter Rabins and Nancy Mace, and it's continually being updated. So it has a lot of great information about caregiving, definitions and information on Alzheimer's and other types of dementia. If you would like to have this book, all you have to do is email to get it, and the email address is delray@arden-courts.com. So it's delray@arden-courts.com. Send an email giving them your name, address, phone number, and they'll be happy to get a book in the mail to you right away. You'll be glad that you did, or share it with somebody that you know that would be really helpful to them, because it is a great book. I highly recommend it. So my guest today is Seth Levy, PhD in public health, and he is with us. He's a partner at Doctors House Calls, and they do what they say. They go into the house and make house calls. But now with the COVID-19, and people sometimes don't want to have someone in their house, or maybe they're afraid, you have now also got on the bandwagon of telehealth. And that's what I want to talk about a little bit now, Seth, how telehealth has changed the game, so to speak, for patients and their doctors.
So telehealth right now is going to become, and it will become even more and more needed as years go on. So what's going to happen in the near future is we're going to actually be able to have what's called a hospital in the home. So not only will we be able to reach the patient through telehealth, we'll also be able to know everything that's happening with that patient real time, 24/7, what their blood pressure is, what their weight is, what their temperature is. Everything will be recorded on a real-time basis. We'll be able to do heart rate. We'll be able to know what their oxygen saturation is 24/7. So it's pretty amazing what we're able to do and set up in someone's home that needs it, which in the end also will significantly reduce the cost for Medicare. Right now, the average cost for an ER visit is about $15,000. That's walking in the door, where we can basically do just about anything that can be done in the hospital, in the home. If a person, besides the medical visit, if they need an EKG, a sonogram, an echo, blood draw, x-ray, home health, physical therapy, whatever it is, we can have it done, ordered and done in the home. And I just want to mention something. I've been doing this mobile physician stuff for a long time, and I want to put a plug into Arden Courts. We have had the pleasure and honor of working with them many times for many of our patients. And the people there are extremely professional, extremely caring. So if you have a loved one that's in the need of some type of dementia care, I would strongly recommend Arden Courts. And no, Marcia did not pay me to say this.
Thank you very much. We
Well,
love
it's
our
true though.
advocates. Yeah, we love our advocates
Yeah.
for our memory care, and I appreciate those kind words. So when people are doing telehealth now with their doctor, they need a physical. And I had firsthand experience watching someone do their annual physical via telehealth not too long ago, about a month or so ago. And the nurse came on and she asked tons of questions, just like they would ask if you walked into the doctor's office.
Yeah.
But you have to do your own weight, right? Check and
Home,
tell
you
the
have to do
nurse,
your own weight, you have to do your own blood pressure, and you have to do your own temperature. So if you don't have the
right?
equipment to do that, so there are limitations on telehealth. A doctor cannot palpitate you. They can't. They can listen. There are devices today that they can actually listen to your heart. They can look at your ears, your nose, your throat through different devices. But through telehealth, it's somewhat limited. But again, once they're able to develop more of the hospital to home, they'll be able to do more things. One of our claims to fame is basically helping hospitals significantly reduce their hospital readmissions. And as you probably know, hospitals are fined when someone comes back into their hospital in 90 days or less in today's world. Now, Marcia, you had mentioned something to me about the different types of tests that are out there. So there's basically three, maybe four different types of tests that are out there. There's the nasal test, which is the long stemmed swab that goes all the way up into your brain stem, basically. It's extremely uncomfortable and annoying. Then the next one is what's called a nasal rene, which goes into the nasal cavity, but only swabs around the inside of your nasal and is not uncomfortable. They now also have one that is oral, that is vocal, that's a swab inside of your mouth. There is another one now. Well, there is one also called the rapid test. I'm warning everyone right now. The rapid test at this point is extremely unreliable. And somebody said to me just today that, well, I can go get the rapid test for $75. I'm like, great, go waste $75. A lot of false negatives, a lot of false positives. So if you're going to get the test, whether you use Dr. House calls or whether you use someone else, make sure that you're either getting the short nasal one, the nasal rene, or the long nasal. And they're both basically pretty accurate. I don't think at this point there's anything that's 100%.
Well, yeah, that's another whole topic about the reliability, but I do want to let everybody know I've been tested twice, not because I sought it out, but because I was mandated to, because I do work occasionally inside the memory care assisted living. And so the state of Florida has mandated that all long-term care health workers be tested every 2 weeks
2
for the
weeks.
period of the next 3 months, right? So I don't know if a lot of people know that. A lot of caregivers out there,
Yep.
family members might not realize that, but they are testing the long-term care workers every 2 weeks for the next 3 months. And so the first one that I had was the real long stick like you're talking about, that you go and someone pushes it up, and you said it perfectly. I thought they were going to hit my brain as far up as they went. And it really wasn't painful per se. It wasn't like, you don't feel pain, but uncomfortable, like you described, very uncomfortable. It just wasn't a good feeling. And they do it on both sides, right? So not only
Yep.
once, but twice. And then about a week and a half ago, I had to go back in to take another one. And this one was the oral one. And I thought that was interesting because it's self-administered. So I just for everybody, I mean, you know about this because you do them, but just to let everybody know what it's like is that you have a little swab. It's a short little swab in a little plastic tube, and you take it out. And before you have the test, you have to go outside. They made me go outside and cough like 5 or 6 times. Cough deep coughs from your lungs, right? And then you come back in into a secluded area and take the swab myself under the tongue, up on the roof of your mouth, on both sides of your cheeks and on your
The
tongue, and
cheeks.
all around, right? And then you put it into the tube, seal it up, and off it goes, right? So that was my second one, and I just got the results back that it was negative. So I've been negative both times. So I think I've been really good at social distancing and wearing my mask and staying safe. But this is something that now I'm going to be required to do for the next
Yep.
3 months, every 2 weeks.
It'll
So do
probably go
you,
till the end of the year.
wow. So do you see, as far as reliability, that's what we were talking about, do you see that one type of test, like the nasal, is better than the oral or vice versa? Or have there been any studies regarding that
Okay,
yet?
so let's look at the three different ones you just mentioned. The long nasal, we'll call it, the nasal ring, the short one, and the vocal, the mouth. So the long nasal and the short nasal are pretty accurate. They're very similar. What might happen is because the way a virus travels through your body, you could get all three. You could get the long nasal stem, the short nasal stem, and the mouth, the vocal. And most likely, let's say you're positive, most likely the long stem nasal and the short stem nasal will probably come out negative. And there's a possibility that the vocal one might come out, they're positive, but this one's negative. Why? Because the way the virus travels through your body, it might not get to your mouth area because it was already in your head and in your nasal, upper nasal and lower nasal, but hasn't reached into your throat and into your mouth yet. So that's a possibility. So again, the best two are the long nasal and the short nasal, the nasal ring. Those are the two best and the most accurate.
Okay, well, good to know. There's also a lot of variables. I know with the oral one, not only you have supposed to be coughing up to try to get stuff into your mouth, right,
Exactly.
orally, but with that oral one, you're also not supposed to eat or drink anything 20 minutes prior to. So that's another rule. So if
Yep.
someone maybe did and didn't think about it, I mean, not even water, they told me. So if someone
Yep.
didn't think about it or didn't follow that rule, then it may not
Sure.
even test well because you have all those other variables to consider.
Yes. And the short, again, the short nasal ring is the one that I personally prefer because number one, it's the least annoying of the two, and it's pretty accurate. Again, nothing's 100%, but they're showing that that's the most accurate. And again, the the number one vector is the air. So obviously, we're breathing through our nose mostly. Um,
I
and
see people that don't wear their mask properly. They have them here,
yeah,
but
we
their
call them
nose
chin
is
guards.
exposed.
Yeah, they're
Chin
chin
guards.
guards. It's kind of
And
silly,
that just defeats the whole purpose. That defeats the whole purpose
extremely.
of covering everything. So, if you're out there and you're one of those that hold it down on your chin, pull it up, keep it on. So let me ask you this question. Do you know why it's taking some testing sites so long to get results back? Is there
Because they're
um,
overwhelmed. They're overwhelmed. I mean, I literally just picked up an extra uh, 50 swabs today, and we just did 300 last week. We just did 56 today, whatever it was. And every day I'm picking up more and more, and they're running out. And these places get backlogged. There's three majors that are producing the results. There's Quest, LabCorp, and BioReference. Those are the three big labs that are, testing the swabs, and they're backed up. It's that simple. Um, but we're actually now creating a portal, so we'll get our results much faster than the average right now, which is 10 to 15 days. That's the average.
Yeah, the first one that I had, which was the long stick up the nose, I actually received a call from the Department of Health in Tallahassee, Florida, and they gave it to me over the telephone, my result. And then when I did the
Huh.
second one orally, I got that result and they emailed that result to me.
How long did
So
it take you, the first one, the second one?
first one was a lot longer. It took
Really?
yeah, that one took a lot longer. It was probably at least 10 days or 12 days before I got it. And then they called me a second time, like a couple days later. And I was a little bit nervous about it because I said, what happened? Did you change your
Yeah.
mind? Did the test results change? And she said, oh no, did we call you before? I said, yes. And she said, well, we're just making sure we're trying to get notices out to everybody, and we split up the call list. And I guess, my name came
Yeah.
up twice
It's
or
better to
whatever,
get
but it
double
was
than
still
nine off.
exactly. So it was still negative. I was happy to say. We're going to take a quick break, and when we come back,
How
we're
long
going
did
to
it take
talk
you the
more about
second one? How long for the
the
second
second
one?
one. A lot quicker, like within a week, with shorter than a week, maybe 5 days. So
Five
yeah,
days?
that was good. Yeah. So we're
Good.
going to take a quick break, but we'll be back in just a minute. So stay with us.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teele, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
My guest today is Seth Levy, PhD in public health and a partner at Doctors House Calls, a mobile organization of doctors and nurses and techs that go all over South Florida and do not only house calls, but now telehealth. With the COVID-19, you're extremely busy. This is something now that has evolved to. You mentioned before break about someone paying, you quoted $75 for a rapid COVID-19 test. So speaking of cost, are there different costs for different tests, and how does someone pay for that? Is it covered by insurance or is it private pay?
Okay, so first of all, let's talk about the COVID test because, again, the antibody test is really not meaningless, but you're going to waste your money. So the COVID test is covered by Medicare. So if the patient has regular traditional fee-for-service Medicare and is secondary, there should be no out-of-pocket cost for the test, as well as if you're having a visit, whether it's in person or whether it's through the telehealth system. Other insurances will depend on what that insurance does or not. Most insurances will cover some part of the test or all the test. Now you got to remember there's two parts to this. Very interesting, actually. So let's say, Marcia, that you decided, or you had a friend of yours that said, I want to just go get the test right now. And they walked into Quest or LabCorp and they said, okay, here, the test costs, I think they charge $129, right?
Uh,
So, and then they charge Medicare and, anyway, or whoever the insurance is. What people don't realize is every single time that something is done, there has to be a physician that's ordering that test. So for us, or for anybody, so there's somebody in the back in Quest or LabCorp or wherever, there's somebody writing that order. So whether it's for blood, for urine, for an EKG, no matter what it is, any kind of lab, any kind of diagnostic, there's always got to be an order, and the order is signed off by a doctor. So even though I might have one of my nurse practitioners going in and he or she signs off on it, my doctor is also approving it as well. My doctor is Dr. Howedy, Howeedy, and if you look him up on health grades, he's extremely highly rated. So we do have the doctor behind us. But again, every order that's done is ordered and signed off on by a physician.
So that being said, let me ask you this question. What
Sure.
about all these people that you see them all the time on the news reports, that they're in long, long lines in their cars, waiting sometimes for 5 hours to get a test, and they're at a testing site, right? And they're going to get a test for COVID-19. Do they all have doctor's orders?
The answer is yes, but afterwards. So those tests, just like when they came in to test you at your facility, those are being run by the health departments of those different states. So again, they're still being ordered, but they're kind of like, because they're the state, they don't have to have the order ahead of time. And they may or may not be charging, they're not charging the insurance, they're just paying the lab to do the results. But because it's a state, um, they, there's no charge. That's why those are free. And that's why people are waiting in line, because there's no cost to those tests.
So there's
And
no
there's a lot of
cost to
people hurting
everybody.
right now that, don't have the money for a test, even if the insurance is paying for some of it or all of it. And they might not know that.
So that's why we're seeing these long lines, because it's a free test, right? People can go in, they might
By
not
the
have
health
insurance,
department of that state.
right? By the health department of that state. They don't have maybe insurance. Maybe they're not on Medicare yet, and maybe their
Yeah.
private insurance doesn't pay, or they don't have private
Or they
insurance,
don't know. Or they don't
or
know.
they don't, or they don't know. But should they all be there waiting to get tested and being in line for 5 hours? I mean, who should be getting tested? I know they say the more tests we have, the more positive cases we have, and they want the
Well,
numbers. But should people be going there and waiting in line like that to get tested?
in a perfect world, everyone should be tested. But the caveat to that is, if we had a magic wand and waved our magic wand and everybody in the United States got tested today, and we got the results back in 24 hours, right? And then the idea would be the people that were negative just go about their business. The people that were positive would have to self-isolate for 14 days and then get retested again. That's the perfect world. But Miami-Dade, you'd have to have 2.8 million people tested. That's just Miami-Dade alone. So it's not practical. So they do something called sampling, where they'll take a segment and they'll just test two or three people in a particular area that know that they're in that small area. And then they'll come up with an idea of what the percentage of positives and negatives will be in that particular geographic area. Is it precise? No. Does it cover everybody? No. Again, in a perfect world, we would have had our supplies, we would have all been tested, and we would know right now, you know, does it segregate people in some ways? Yes, because you're going to have the positives and you're going to have the negatives, which is not the greatest thing in the world, but at least you would know.
But then people would have to go back and get retested, because just because they were negative doesn't mean that down the road they're not going to get exposed, and they would want to know, and they're going to have to keep going and getting retested, kind of like they're doing now in the long-term care facilities.
In the facilities.
Retesting.
So,
Mhm.
which is true. But the other factor is in the long-term care facilities, whether it's an AL or whether it's a nursing home, they're testing the staff people. They're testing the staff people because those are the people that are coming in and out. However, in my opinion, especially in an ALF, they should be also testing the residents. Not so much in a nursing home situation, and not so much in a facility like yours. It's memory care, because those people really don't go out.
Right.
But in an ALF, these people do go out every once in a while, and it only takes one time.
Yeah, I hear you.
So it's
Yeah.
great that they're testing the workers coming in and out, but again, you know, one of the CNAs in a facility in an ALF, he or she gets tested. They go home to their kids and their husband or whoever, and then they come back the next day, and they might have gotten infected. So because it's through the aerosol, because it's through the breath, because it's through the circulation system, it's extremely easy to catch.
Well, that's the message we're sending to everybody to, mask
Yes.
up, social distance, wash your hands. We do have your office number up there on the screen, 888-606-0227 for Dr. House calls. So you can contact and talk to Dr. Seth Levy and call them if you're interested in having Dr. House calls or telehealth. We also have your website. I have it at www.doctors-housecalls.com, so people can
Correct.
contact you if they have any questions. And we only have 1 minute left, Seth. So your best message to keep healthy and safe is
The
wear the
best message
mask,
to keep
right?
healthy and safe is wash your hands, keep a mask on, wash your hands, keep a mask, and social distance. And if you need us, call Dr. House Calls. Remember, besides the medical component, anything else that you need is done in the home. So besides the medical visit, EKGs, sonograms, echoes, blood draws, x-rays, home health, physical therapy, whatever you need in your home, we do. And if you're on your Medicare and a secondary, there's no out-of-pocket cost.
And that could be a real benefit to a lot of people now. They're staying home, social distancing, isolating. And so if you're worried, give Dr. House Calls a call and get taken care of. Thank you, Seth, for being here today. I really appreciate
Thank you,
it.
Marcia. It's great to
And
see you. You always look great.
thank you. Well, you stay safe. Keep that mask on. I want to get one of those Wonder Woman ones. And thank you all for tuning in and watching Caregiver Solutions Info Show today. You can catch us every Tuesday, 6 to 7 p.m. Also on the iHeartRadio app under WNN if you want to listen. And thank you again. And stay safe, everybody. Do like Dr. Seth says, wear your mask. Do everything you can to stay safe and healthy. Until next week, take care, everybody. We'll see you next time.
Thank you, Marcia.
Bye-bye.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week. as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more.